Welcome to our open enrollment meeting for KPG Home Health. My name is Bill Hammett. I'm the insurance broker for KPG. Happy to be that. We're a resource to you not only through this open enrollment period, but throughout the year, and as a great place for escalated issues, any questions you have, doctor issues, claims issues throughout the year, and then RSL is there as well for anything you might need. Please lean on us now and throughout the year should you need our help. Just quick agenda. We'll talk about our timeline. We'll talk about medical, dental, vision, how we enroll. Some dates here. We started open enrollment officially on Monday. We're asking for everybody to be done by this next Monday, the 9th. I realize today's the 5th. If that's a little too tight of a turnaround for you, if you need extra help, please reach out to me or to Anna. Happy to help you through any questions you have. Hoping as best we can to hit that March 9th deadline. This is open enrollment. This is your choice to make any changes you want. Add people, remove people, upgrade your plan, downgrade your plan, add dental, remove dental, whatever it may be. Asking for this all to be done by March 9th, and you'll do all this through your Gusto portal. So we have 5 medical plans. So we had 4 last year. We added 1 more this year, an HSA eligible plan. What you need to know about these plans before we get into the details is there's 2 different PPO networks. There is the full PPO network, and there's the Alliance network. We'll talk more about the Alliance here in a second, but the full PPO network is the big Blue Cross Blue Shield PPO plan. The HSA eligible plan is on that full network. There are 2 Alliance plans, and the reason why you might want Alliance is because it's a lower cost. So just a little bit more about the Alliance network. It's only for people living in Maricopa and Pinal counties, and it focuses on Banner Health and Honor Health as the provider groups delivering the care. If you are happy with those provider groups, if you are living in those areas, this is a wonderful opportunity for you to save a few bucks on your health insurance policy simply by limiting some of the providers that you'd be eligible to see. Here's a side-by-side again for those of you on phone not able to see it. What you're seeing, or what you can't see, on the left is our $2,000 deductible PPO plans, one with the full PPO network, one with the Alliance network. Again, Alliance is going to be a little bit lower cost out of your paycheck. And then we've got our $2,500 deductible PPO plans, one Alliance network and one full network PPO plan there. Again, limited network on the Alliance. For those of you that are actively accessing care, going to doctors, you might have surgeries, you might have a baby coming, whatever it may be, I would recommend you lean more towards the lower deductible $1,000 policy. For those of you that just have a health insurance plan in case something goes wrong, you just need a doctor visit here or there, maybe urgent care, your annual physical, those $2,500 deductible plans are really strong benefit plans for a good price. We have our HSA plan. This is new this year. Here's what you need to know about an HSA plan. Really wonderful because it gives you the opportunity to put several $1,000s aside into a health savings account. This is money that could go in tax-free. It rolls over year after year. You always control it. It is never use it or lose it. Okay, so HSA plan, HSA accounts are never use it or lose it. The drawback is you must have a very specific medical plan, and this HSA Plus plan is that plan. And with an HSA eligible plan, you have a very high deductible. In this case, it's a $6,000 deductible. And you have to pay 100% of all of your medical needs, doctor visits, prescription drugs, hospital stays, surgeries, MRIs, everything 100% out of your pocket until you reach your deductible. So for those of you that are using a lot of healthcare, a lot of MRIs, lots of doctor visits, this is probably not your best choice. But for those of you that really never use your health plan and would love the opportunity to put a little money away tax-free, this is a wonderful opportunity for you. And I'll stick around at the end of this presentation and answer any questions that you guys have on health savings accounts, the health plans, and all that kind of stuff. Little highlight on how you find a doctor. We've all been with Arizona, Blue Cross Blue Shield of Arizona, so you should already understand, but just in case you didn't, you go to azblue.com. You scroll down, you find the Find a Doctor button. Once you get there, we're looking at coverage year 2026. It's employer provided, it's medical, and then here's our Alliance PPO, and then our full PPO is our statewide national PPO. So those are the networks you'd be looking at if you are in one of those plans and searching for a provider. Some more information on how you can access your benefits. You will get an ID card. For those of you that already have an ID card from last year, you can still use that until you get your new ones in the mail. I would imagine many of you downloaded the smartphone app. This is a great way to stay connected with these guys. And then other ways, phone calls at the website through the membership email. So lots of ways to get in touch with Blue Cross Blue Shield. Also some telehealth available. So when going to a brick and mortar provider doesn't work for you and you want to talk to someone 24/7, you can do so. Lots of different ways to access it from colds and coughs to more mental health, behavioral health type of issues. So like cold, flu, fever, headache, pink eye, insomnia, anxiety, depression, other items like that. So this is your fastest way to care through your Blue Cross Blue Shield plan. We'll talk dental now. Any questions on anything medical that we went over really fast there? All right. Everybody will have a chance at the end for questions as well. So Guardian is our dental plan. We've got a $3,000 maximum benefit plan. Orthodontia is included in that. It pays for 100% of the cost of any preventative type of issues. It covers 80% of basic services. This would be cavities. This would be sealants. This would be root canals. This would periodontal issues. And then major. So these are the crowns. These are the dentures, implants, stuff like that. And there is a rollover feature. Nobody has any rollover dollars from last year, but if you go and get a couple of cleanings, but you don't use a lot of your annual maximum, you will have the ability to roll over as much as $500 extra dollars to future years. And you can do that all the way up to $1,500 extra dollars. Really a nice feature because most of us have steady years with dental and then we have one big expensive year, and having these rollover dollars is very helpful. I circled this 90th percentile. This means that they pay 90%. If you go to a dentist that does not take Guardian, this plan still pays 90% of what is deemed to be usual and customary. So a lot of buzzwords there. All that really means is if you find yourself at an out-of-network dentist, this plan pays a little better than most other dental plans, even though it won't really totally knock your socks off with non-contracted dentists. Any questions on dental? Okay, our vision plan, same as last year, $10 copay for once a year eye exam, $25 copay for once a year materials, and $200 frames allowance every 2 years. So also you can get elective contacts for $200. If you need them, if they're necessary contacts, they're 100% paid. So very straightforward vision plan. $10 copay for eye exam, $25 for material for lenses, and a $200 allowance every other year for frames. Any vision questions? So again, here's a plug for the Guardian app, the mobile app. Also, you can go on to guardianlife.com. This is just the Find a Dentist one, but as you can see, I added some of my notes. You can search Find a Dentist, or you can search Find a Vision Provider on that same website, and you can look through and find them. Your dental network is the Dental Guard Preferred. So we're the Dental Guard Preferred network. That's the PPO network. And your vision plan, there's only one vision network. So that's how you'd find a provider there. We have a benefits microsite available to you. All of these things that you're seeing here, all the flyers, we've collected all of these different things and put them into one website. We'll see if we can link this to the dashboard and the Gusto account for you. So you can get here, you can download summary of benefits and coverages. You can look at all the different links to websites and resources we've got there for Guardian, for Blue Cross Blue Shield. At the bottom there, we've got the phone numbers for ourselves, our email addresses, as well as contact for the different insurance companies that you're working with. So this is really meant to be kind of the first stop for you guys. If you're like, I don't know what to do or where to go, you can come here and you can figure out if there's the answers already there, or if you need to reach out to someone with us or with the carrier. So enrollment, this should be pretty easy. You're going to do it through your Gusto portal. Many of you have already started this. You're signing into that just like you would sign in any other time, and follow through all the prompts to get yourself going through the enrollment or waiver. If you're waiving the policy, that's okay too. You'll do all this through the Gusto portal. And we're asking that you do that as soon as you can, hopefully to complete by Monday, March 9th. And if you have any questions, if you need any answers, I'm going to stick around on this call. But this last slide is my information as well as Anna and Araceli's information if you'd like to reach out to either of them for any help. But that's the end of my presentation. I wanted to keep it nice and fast for you, but I will stay here as long as anybody has any questions.